My name is Beatrice Bilò, and I am the chair of the National Allergy Society Committee. This year in Lisbon, we have the pleasure to interview some presidents and representatives of the National Allergy Committee. So it is a pleasure for me to have Professor Shekerel, who comes from Turkey. So please, Professor Shekerel, could you introduce yourself?
Okay. I'm the president of Turkish National Society Allergy and Clinical Immunology for 2 years. But actually, I'm a pediatrician. I'm a pediatric allergy and asthma specialist. I work as a director in Hacettepe University, Pediatric Allergy and Asthma Division. I became a pediatric allergy immunology specialist almost 25 years ago. Besides educational activities and clinical services, I am interested on some research areas such as epidemiology, burden of allergic disease, and rational diagnostic and therapeutic interventions in the field of allergy.
Yes, as you know, the National Allergy Society Committee is an interactive platform, and its aim is to improve interaction and the trust between EAACI and the National Allergy Society. So what is the relationship between EAACI and your National Society?
Oh, this is really a very nice question. When EAACI was first established, it will only accept the societies from EU countries. But almost 20 years ago, EAACI has changed its policy and accepted the members' societies from non-EU countries. And Turkish National Society Allergy and Clinical Immunology is one of the first non-EU member society. And during these 20 years, we worked with very close collaboration with EAACI. And we have organized 5 summer schools and 1 EAACI Congress in our Turkey. And also, if we look at, according to the belief of Turkish allergy and asthma specialists, EAACI congresses are the ones of most prestigious scientific activities in the field of allergy and immunology. With the advantage of geographic proximity, Turkish allergy and immunology physicians attending EAACI meetings very frequently. And they follow EAACI guidelines, they follow EAACI suggestions, and they are reflecting them to their clinical practice.
As you know, in some European countries, the full specialty of allergology has not been already recognized. So what is the situation of the specialty in your country?
Okay. First of all, the allergy and immunology subspecialty is one of the most preferred subspecialty in my country. In order to become allergy and asthma specialist, you have to train for 7 years after medical school. Mm-hmm. The first part, the first 4 years should be done in the main branch services. To become a pediatric allergy immunology, you have to train in the field of pediatrics. And thereafter, you have to take an exam as a competitive and a hard exam to admit to the asthma, allergy, and immunology program. For becoming an adult allergy and immunology specialist, you have to take your main branch in the field of internal medicine, pulmonology, and dermatology. And after this main branch, you have to take the exam and to enter to the allergy immunology fellowship training program.
Oh, many thanks for this interesting information. And now I want to go on speaking a little bit on allergy care, for example. There is a very recent survey made by the National Allergy Committee and the UAMS that clearly shows that the spectrum of allergy services and care is very heterogeneous across Europe. So what is the situation, the landscape of allergy care in your country?
Okay. First of all, studies have shown that 1/3 of Turkish population is allergic, has any type of allergic disease. In addition to that, most frequent reason of school and work absenteeism actually due to allergic disease, such as asthma, food allergies, or allergic skin diseases. And another point which is also important is if you look at the health-related expenditures, almost 10% of Turkish health-related expenditures are due to allergic diseases. Taken all together, allergic diseases are one of the major health problems in my country. Allergy and immunologic problems usually taken by a wide variety of physicians, particularly family physicians. But the complex and complicated issues are taken care by allergy and immunology specialists. At the moment, in my country, there are 400 asthma and allergy specialties. 1/3 of these are adult allergy asthma specialists, and 2/3 are pediatric allergy and asthma specialists. Turkey has a young population, but the population is getting older, and which means that in the future we need more adult asthma and immunology specialists. The structure of asthma, allergy, and immunology specialty enables the structure of the American structure.
Well, could you now tell us something about your society, especially in terms of scientific activities?
I think Turkish National Society Allergy and Clinical Immunology is more organized and comprehensive society than thought. It has structures that emulates EAACI, but it can be described as more amateur, of course. We organize annual congresses with 600 to 700 attendees annually, and in addition to that, we also organize 10 masterclass symposia for the training of Turkish physicians. In addition to these congresses and masterclasses, we also organize allergy schools, which is only focusing on allergy immunology fellows. Allergy and immunology fellows can attend to the congresses, symposia, and schools without paying any fee. And in addition to these congresses, we also provide some scholarships to the young scientists to enter to European Congress, and in addition to visit some of the international science centers.
So thank you very much for all these interesting informations coming from your country, and thank you very much for being here, and enjoy Lisbon meeting.
Thank you very much.